Most of our organs are enclosed by connective tissue called fascia. It's what holds everything in place, helps muscles do their job, and forms a flexible protective layer for blood vessels and nerves. Sometimes a weak spot will form in the fascia, and part of an organ bulges out where it doesn't belong. This is known as a hernia. Hernias don't usually involve bleeding, and some don't even have any symptoms. But they can be risky if left undiagnosed, so it's worth knowing about them. First, let's take a look at the most common types. A hiatal hernia occurs when the top of the stomach bulges up through the diaphragm. This can allow digestive juices from the stomach to travel up into the esophagus, and because the esophagus doesn't have a protective lining like the stomach, it can get damaged. In an umbilical hernia, part of the intestine pushes through the umbilical wall near the belly button. It's quite common in children and often goes away by itself after a few years. In adults, it's a bit more serious and tends to require an intervention. Outwardly, a femoral hernia looks like a lump or bulge on the inner thigh. It's caused by part of the intestine falling into the femoral canal, which carries a large artery to the leg. An incisional hernia happens after surgery, when the intestine pushes through a weak spot in the abdomen where the surgical incision was made. Finally, an inguinal hernia is when part of the intestine or bladder pushes through the lower abdominal wall or the inguinal canal, a passage just above the groin. Umbilical hernias in children frequently resolve themselves, and some adult hernias are also minor enough that no treatment is necessary. It's important to keep monitoring them, though, as complications can be serious. The most common treatment is surgery to move the displaced organ back to its original position. The weakened fascia tissue is often closed up with synthetic mesh to prevent a future hernia. Hernia surgery is commonplace and relatively simple. These days, it's usually done using a thin fiber optic cable complete with miniature surgical tools that's inserted through a tiny incision. This is known as laparoscopy or keyhole surgery. It's generally safer than traditional surgery, with a shorter recovery time and a lower risk of complications. Mild to moderate cases of hiatal hernia either have no symptoms or can be controlled by diet and lifestyle changes, making surgery unnecessary. Diets to control hiatal hernia typically exclude acidic foods like citrus and sodas, as well as coffee, alcohol, and chili. For more information on hernias or any other issue, talk to your doctor.